watching CBS 2 News in high definition.
Could a deadly blood disorder be turned into a life-saving treatment for cancer?
That is what a new study shows, and CBS 2's Dr. Max Gomez here to explain that it could make sickle cell anemia a way to treat resistant cancers. How about that, Doc?
Yeah, that's right, Maurice. Sickle cell anemia is a genetic mutation that fills red blood cells with abnormal hemoglobin. But that same mutation turns those sickle cells that are deadly in otherwise normal people into sticky cancer killers. Here's how. This is what normal blood flow looks like under a microscope. Millions of tiny red blood cells flowing freely through capillaries. But when the red cells are filled with abnormal hemoglobin, the molecule that carries oxygen in blood, the cells have a tendency to change from donut shape to crescent or sickle shape.
The sickle hemoglobin becomes extremely rigid, and the cell itself becomes extremely fragile. Most importantly, the cell becomes extremely sticky.
It's that stickiness that Dr. David Terman thought could be exploited for cancer treatment. Turns out that blood vessels in tumors, here on the right, are different than normal vessels in the body, seen on the left. Their inner lining is also sticky, specifically sticky for sickle cells.
The net result is that they form a cluster in the tumor blood vessels. And that cluster ultimately leads to a plugging of the tumor blood vessel.
Here's what it looks like greatly magnified. The bright dots are human sickle cells flowing into and getting trapped in a mouse tumor. Once trapped, not only is the tumor starved for blood,
as they cluster, they die. And in so doing, they release their contents, which is extremely toxic to the surrounding blood vessel wall, or the cells of the wall, and the tumor itself.
Dr. Terman says small amounts of matched blood cells could be transfused into cancer patients, where the cells would get stuck in tumors, killing them off. Now, those small amounts of sickle cells would probably not cause any harm to the patient, since they're mostly sticky in tumor blood vessels. Better yet, the sickle cells can be engineered to carry additional toxic cargo into the tumor. Clinical trials could start within 2 years. Maurice?
All right, Dr. Max, thank you.